So, hello everybody. Yay, I'm so excited for this one. I even woke up a week in advance for it. I was quite disappointed to find out I got my days wrong. Anyway, it's the right day, and I'm speaking to Moira Bradfield. Moira, I want to know how you got into being, what is it, a vaginal microbiome specialist?
Yeah, so I'm a naturopath and an acupuncturist, and I have a special interest, is what we're allowed to call it in Australia, in the vaginal microbiome. So all things to do with the vagina, particularly recurrent infection, because that frustrates me and inspires me as well, because you sort of need to find all of the keys to understand a recurrent issue.
Yeah, absolutely. I mean, I must admit that, okay, we heard about the microbiome, it started coming up as like a golden child a couple of years back, but the vaginal microbiome, I think, was kind of like dismissed. It was all about gut microbiome, skin microbiome, I think, came next. And if I remember, I remember seeing some adverts for douching solutions that contained bleach and all sorts of things like iodine. That must have done terrible things to the microbiome of the vagina. Absolutely.
Definitely. There's a
So,
long history of things that have damaged vaginal microbiome, I'm sure, and microbiomes all over the body. So, but it is,
yeah. So,
yes.
I'd like to know how you got into it. What's your story there?
My story is there's sort of two prongs, I guess, to my story. One is as a practitioner, I had a run of clients that had vaginal discharges that weren't necessarily diagnosed as anything in particular, but they were pretty, I can't think of the word, but they were telling me that that wasn't their normal vaginal discharge and that they wanted to change it. And as I started to work with them, I realized that they weren't responding the way I would think that they should respond. And so I really threw myself into finding out why. And from there, I became more and more inspired, because it opened up. We're on the verge of a birth of information, essentially, to do with this microbiome site. And as each month goes by, more and more lands in my inbox. And so I'm just really devouring that as we go through, because as we've moved from culturing, which is really old school now, and we have DNA and RNA profiling to see what's going on with bugs in different sites in our body, we really are understanding more and more about what's living there and how they interact with each other. And then the other side of that is, as a female, I have a history of recurrent urinary tract infections.
Yeah.
And so through my work with health, I've managed to come out the other side of that, and it's probably been a good 10 years now. But in retrospect, with all the new information that I have, it makes a lot of sense. So if I had my time over again and I was in the current information, time frame, I would treat myself very differently and probably not use as many antimicrobial herbs or even antibiotics as well, to get me through those stages. So, there's a time and a place for those things, but we need to consider carefully what we might be doing to our microbiomes.
Okay. Wow. There's so much I want to talk to you about. I think what I'd like to start with is, because discharge was like the red flag, the thing that people noticed was wrong with them. Let's have a little discussion about what discharges are, and the spectrum of normal to abnormal. So what would you say is normal?
So it's normal to have a discharge, and it's normal for that discharge to change in quantity, texture, color throughout a month.
Yeah.
And that's dependent, in a menstruating person, that's dependent upon where their hormones are. So we certainly have different discharge at the beginning of the month post menstruation, which might be quite pasty or tacky, or maybe none at all, and then moves through to becoming a little bit more volume. Certainly that clear raw egg white texture, the tackiness that we see around ovulation. So the classic is everyone's doing this, so it comes up between the fingers, and then post ovulation we see that decline and go back into perhaps some white, and if not even a little bit thinner and milkier discharge. So that can be quite normal. But what we see is that when people see a change to their discharge, or if they're concerned about it, or if there are other symptoms associated with it, that's when we start getting into the realms of abnormal. So there's lots of different influences on a normal discharge,
Yeah.
and hormones are the biggest influence that we see, but that's because they're influencing those microbes that exist within the vagina itself.
And there is a big interplay between hormones and those particular microbes. And that moves me directly into the fact that our hormones change throughout our lifetime. I mean, that's the whole point of me doing this course, is because we
Mhm.
get given this body and we don't get given instructions or warnings that there's going to be things that change. So how would you describe what happens, say, pre-puberty, puberty, pregnancy years, and then obviously the menopausal times, where I think people notice it the most?
Yeah, so the biggest hormonal influence that we see within the vaginal microbiome is estrogen.
Yeah.
And so at different life stages where estrogen will be at different heights, it will either be absent or starting to fluctuate, moving into a normal fluctuating estrogen progesterone cycle, which we see in menstruation, and then into a peaking and then declining in menopause. Those will see changes within that microbiome. So that from that, if we've got a hormone like estrogen, which increases the amount of cells in the vagina, which means we see the increase in essentially the fuel for the bacteria, which is glycogen, which is acted upon by some enzymes, and we end up with sugars in there that then the lactobacilli utilize, which are the main microbes. They utilize that to proliferate essentially and grow in numbers. And by doing that, they then maintain the balance or the homeostasis in that area, because they produce their own acids, lactic acid, and they produce hydrogen peroxide, and they are part of that immune system in that area. So they maintain an acidity, which is the defense essentially against other microbes that you don't want there, and they produce antimicrobials themselves against other microbes. So if we look at a lifespan where we have everything from birth right up to menopause, post-menopause, we see that at birth, if it's with female children, there's um, maternal estrogen. So actually in that first 8 weeks, they know that maybe there's a little bit more going on with estrogen, but then it declines. And so the vaginal microbiome in very early life, up until about 9 to 10, 11 years old, is very different to that of an adolescent and a menstruating person. And that's because there isn't that estrogen there. And so therefore the lactobacilli, which might be there in very small numbers, are not thriving like they would. So we see a very different change, and it's essentially the same vaginal symptoms that we see in menopause. So an atrophy, which is very common. So, and then they've now seen that pre-puberty, sorry, so anywhere from 12 moving to 13, 14, the vaginal microbiome, even prior to menstruation, starts resembling that of a menstruating person. So the hormonal surges that start well before the bleed actually does influences that area. And so we start seeing a microbiome that's more characteristic of an adult, essentially in their childbearing years. So from that age on, we can start assuming that lactobacilli should be dominant in most people. There are some exceptions to that, and that will fluctuate throughout a menstrual cycle normally. So there's always going to be fluctuations, because estrogen does do that, up and down that we see. So they do know that the microbiome isn't static, it's not stable, it transitions throughout a normal cycle, but it shouldn't transition into that disorder or dysbiosis that we associate with infection.
Yeah, and there's that
Yeah.
direct link between the dysbiosis and recurrent cystitis, or what they would have termed interstitial cystitis, right?
When we look at, there's a relationship between the vaginal microbiome and the bladder microbiome. So they know that there's a crossover in terms of what they look like. There's also the vagina itself, when we're looking at microbes that travel essentially from the rectum. So the common E. coli, for example, as a pathogen, it has to traverse somehow. If no one's ever tracked it, obviously it's purely theoretical. There's a traverse, the great track, I guess, across and past the vagina and up, to the urethra itself. But so those sort of ascending infections can be stopped essentially by having a really balanced vaginal microenvironment, and therefore a balanced bladder and urethral environment as well. And then in terms of the vagina and its infectious processes, that having a lot of lactobacilli or a balance and stability means that there's less likelihood of infection, and it's infection from everything from bacterial vaginosis and thrush right through to STIs and HIV. So we see that the acquisition of STIs is increased with the more disorder that happens in that particular microbiome. So there's a lot of research in that area, because you can understand globally that's a really big issue, is how can we decrease that risk.
Yeah, that's crazy. And also they're using a lot of this research for HPV because people are responding so badly to the vaccine. So I think the biggest change that women notice is around menopause. I don't think women tend to know that there's much going on down there until they hit menopause, and suddenly a lot of stuff starts happening down there. Is there any advice that we can give people that will help to keep the microbiome as probiotic as opposed to dysbiotic as possible, and especially around the significant changes? And I think the significant changes would be around childbirth, because you want to have a healthy microbiome, obviously, if you're going to have a vaginal birth, but also during menopause.
Yeah, so I mean, I guess in my practice, I always talk about prevention is better than having to fix it or cure it at the end.
Yes.
So for me, working with people moving into fertility is optimized by having a balance, because conception obviously is a vaginal to cervix based enterprise.
Yes,
So
usually.
you need to have a balance in that area as well. And there's, even with IVF, there's a whole lot of research now looking at vaginal microbiome and the
Wow.
success rate of IVF, and preterm births and incompetent cervixes and all sorts of things. So if you can move into your pregnancy with a balanced vaginal microbiome, you're more likely to maintain that, because we know in pregnancy, the vaginal microbiome, because it's not under the influence of those fluctuating hormones, is much more stable. So if you
Yeah,
go in with an imbalance, you're possibly going to keep that imbalance.
yeah,
But if you go in with balance, then you're going to maintain that. And there are a range of factors. So we know when we're looking at microbiomes in other sites that, diet and plant-based food diversity is really important, because that will influence our gut, which will influence some of the microbes in our vagina. There's also some, just general things to do with nervous system. Generally not smoking is a great idea. Low glycemic index diets and balanced, so low sugar, not necessarily having to go down that whole anti-candida track, because that's quite extreme sometimes, but just a great balanced whole food diet with a great abundance of diverse amounts of plant foods
yeah.
generally will help maintain that balance. And then if there are any risks or any issues, then you can actually directly intervene, then possibly with probiotics orally or vaginally, and even prebiotics in those areas as well. So there's a lot of interventions that we can look at in that pregnancy stage.
So I'm pretty
Um,
sure people are going, you mean you can take probiotics by mouth, but you can also put them down there? What's the process there?
so the process
Yeah.
is
Like, are you just
essentially,
gonna stick a capsule up there, or yogurt, or sauerkraut?
maybe not sauerkraut, uh, but certainly there are companies around the world making probiotic pessaries, so specific applications. But then there are countries like the one I live in, which is Australia, where they're not available. So we'd certainly recommend that if you've got a really great combination of lactobacilli
Yeah.
in a capsule, then there's no harm in actually inserting that very same capsule that you would take orally into the vagina as well.
Yeah.
Um, yeah, so doing that, and generally not having to do it for a prolonged period, maybe a week, and see what effect that has. And then there are, certainly any sort of lacto ferment, so using a yogurt, if that's what you have, will give relief from symptoms from things like thrush and
That's
BV. It may not maintain it unless you continue to do it and then make lifestyle, diet, all of those other changes, but it will offer some relief. And there are research on that as well, and even orally taking those, they see shifts in vaginal microbes as well. So definitely lots of things in the kitchen cupboard you can access,
so
but not.
lactobacillus. Is there any particular family member from lactobacillus? Is it Reuteri or Plantarum? Which one are you?
So there are, and again, it's probably country dependent on what you can access. So when we look at the vagina and the five dominant communities that live there, they talk about Lactobacillus crispatus, gasseri, um, Jensenii, Inus,
Yeah.
and then there are some other less dominant ones. But commercially, crispatus is often available, as is gasseri, but not in every country. And then there's a whole lot of research using two particular strains, which are actually not in that top communities of lactobacilli that we find in the vagina, and that's Lactobacillus rhamnosus and Lactobacillus reuteri, and two specific strains around them. And so that's quite commercially available as well, because of the amount of research that we find on them. So you can find them in combination.
I've seen those two particular ones in the probiotics that are marketed specifically for women. But you say
Yes,
there's
it's
quite a
GR.
few more of them.
Yeah, GR1 and RC14 are the two strains that you want. So yeah, there's definitely quite a lot of them. But I mean, at a pinch, if you've got a lactobacilli probiotic and it's not those strains, I would still use it. So, you will get benefit. Yeah. I tend to steer away when it gets a little bit more complex and there's lots of bifido or some streptococcus and things like that in there, because the effect, I mean, there's some research with bifido, but things like streptococcus, it's a little bit unknown in that area, really, to introduce that into that environment. So
I just want to put a disclaimer here in that I don't want anybody who's watching this to suddenly start putting things inside of them without first discussing it with someone who knows a bit more. And I want your details at the end of this so that people can be pointed in your direction if that's possible. Next section would be menopause.
Yes. So in menopause,
is that drop?
Yes, it's a drop. Well, initially in perimenopause, we see big peaks. So there's actually an increase in thrush in perimenopause because thrush prefers a really high or a dominant estrogen environment. And so we might see those peaks causing issues there. And then even the treatment of that might then cause some bacterial imbalance as well subsequently, so that it's sort of, you get into a bit of a loop. And then as you start to see estrogen decline, it's interesting because it's not in every menopausal female that this will occur, just like menopausal symptoms are not in every menopausal female. So, but the vaginal atrophy, which we see as, presenting with things like pain on intercourse or vaginal dryness, little cuts and tears if there's been, it's like micro trauma to those tissues and those cells, because as the estrogen has dropped away, the cells become thinner. There's less lactobacilli, which also can contribute to some of that natural lubrication in that area as well. So the research sort of tells us it's around about 50% of women will experience symptoms, but around about 70% of women actually have vaginal atrophy in menopause.
So many.
Yeah. And we sort of get...
Some women they really respond well to the estrogen pessaries. And that estrogen doesn't really become systemic from my understanding. It really is just treating the dryness and that sort of area. So
yeah, so I mean, if you're going to use estrogens in menopause, that's now the preferred form, because obviously you're not getting that systemic absorption, and definitely it's very low dose, and it does make huge impacts because it changes the amount of cell density, it improves the lubrication, you don't get those rips and tears, which, I mean, I see in younger women as well, where we have this relative estrogen deficiency going on, or if they've transitioned off a pill, those sort of things sort of happen as well. So it's that irritation post sex, which can be a number of things, but it can also be low estrogen, particularly if there's not a lot of discharge going on for that person through their cycle. So yeah, it's problematic, but the topical estrogen at that point does improve, and that's quite standard treatment for vaginal atrophy. It's just where and when do you stop doing that?
I was just about to ask you. So what kind of advice would you give to somebody who's decided to do that? Because I've heard anything from 5 to 10 years is okay, but I'd like to hear it from you.
So I guess it depends on the individual. I mean, I would preference not to be on things that long, but I totally understand the need, because in a very medical sense, then if you stop that estrogen, what happens? There's no sex life, or if it hurts, or then, you're having to grin and bear it. I don't know. So there needs to be sort of a happy balance. Is what else can we use and utilize if someone doesn't want to be on that? I mean, previously with the systemic hormone replacement therapy, it was sort of, you had to be on it for more than 5 years to get benefit, but that's where that risk kicked in as well. So it is the better solution for that, but it's possibly a very long-term solution if you're not willing to deal with other things that might also give you some benefit in that area.
So say somebody has, we do nutrigenetic testing now, and you can see that you don't respond well to estrogen, and it puts a lot of fear into people. And if you mention estrogen, they almost go into shock. So if you get somebody like this who is dead set against estrogen, what do you do? What's the general advice that you would give them to sort of get them through that stage that is so uncomfortable at transition?
Yeah, so I mean, I have a number of strategies, and some of them are herbal,
Oh yeah.
and oral, and then some.
Not sticking plants in there now.
So we certainly, there is information out there that lets us know things like red clover, in terms of the research, particularly a specific form with a specific amount of flavonoids, gives us sees changes in vaginal dryness and atrophy. So essentially, you're affecting that epithelial, or that cellular surface in the vagina directly with that, and that will see improvement there as well. And that's a lovely all-round menopause herb that's been used.
Yeah.
Also, black cohosh has very similar applications as well. If we're looking at on a vaginal side of things, there is some interesting research for fennel, topically, so applying a fennel cream or a fennel pessary at a specific percentage, in that area. So, and that had some really, positive improvements directly, and it was slightly lubricating as well. And then moving outside of that, when we talk about lubrication, isn't it, finding a good quality lubricant that's not going to cause more issues than it fixes. And there's, we need to consider things like pH and osmolarity, and not having nasty chemicals in there. So those sort of things are important to have a discussion around. I have had some success with clients where we have used direct lactobacilli as well, and they've noticed that improves lubrication, but then you're continually again having to do courses of that to get that to stay. So you're not maintaining that colony of lactobacilli because the estrogen isn't there to support it. So you're better off using more all-body approaches in terms of oral herbs that address multiple factors at once.
Brilliant. This is all such amazing information. Okay, now I want to know, so I belong to your practitioner site, but I know that you've got one that is available to the general public. So let's just discuss you and your site, because it is a wealth of information, and anybody who's watching this and is a practitioner who's going to be working with women, I'm going to say that I've referenced you so often that that's why I just thought, I'm not going to reinvent the wheel. I'm actually going to have the wheel come on here and roll down the hill with me. So tell me about the business side of things.
So, as you mentioned, I have a Facebook practitioner support group, essentially, which is all things vaginal microbiome, and it's called Intimate Ecology Group. So to join that, you need to be a practitioner and provide evidence of that. And in that group, really, it's a place for me to download my brain a lot of the time, or the recent research article that I need to go back and read. So there's constant research updates, there's discussion, there's a lot of very experienced practitioners on there as well that have slightly different niches, pelvic physios, there's GPs on there. So there's a really great discussion that goes on a lot of the time.
Really intelligent questions and comments and discussions. Like I love to lurk. It's one of my favorite lurking spots. And yeah, good research articles that you can either read then or download, but I suppose you do that more for yourself. And then if you're not a practitioner, you've got something else to offer.
So, I mean, part of my life is as I'm a practitioner as well. So I have a clinic, and I have on Facebook as well, and a website, which is the sort of the public side of my business, which is the Intimate Ecology. And so through that, I do post just updates about general vaginal health, and also that's a place where people can book in and see me if they need to consult with me as a practitioner as well. So yeah, that's that side of things.
Do you do any kind of online consultations, or would you have to see people face to face?
No, I have online consultations. It does depend on the country that person is in, because there's some legalities that my insurance doesn't cover me for. It's usually US based stuff. That's the no-go. So, we need to consider that as well. And I do love seeing people in person, because it means I can do testing in clinic and things like that. But there's certainly a need for this service online, and it sort of takes away some of that stigma as well, because it's maybe not that comfortable to sit down and just blurt out your life in vaginal health to somebody as well. And having that screen interface is sometimes helpful as well, because you know that you can shut it down if you need to, or that it sort of distance you. And that's the thing is, you can't go into this area of health without some really personal questions coming out, because the array of factors that influence vaginal health, there's a lot to do with sex, and there's a lot to do with what you do in the bedroom and who you're doing it with, and those are things that I don't necessarily ask just because I'm curious. There are specific risks associated with some things, and it's not that you can't continue to do those things. It's more about how can you do them in a safer way, or how can we minimize the imbalance that might cause in that area for you. So yeah, it's a really a privilege for me to sit down and have that discussion with people, but I completely understand that it might be very foreign, just like maybe sitting down and talking about your poo with people is. I mean, it's quite old hat for us practitioners, but so then this is sort of next level on top of that as well. And I still ask you about your poo. It's not just vaginas, we go through every system in your body. So
if it comes out of that area, I want to know about it.
Any orifice anyway.
Just to say thank you. It's what, 9:30 at your, and then at night, and it's only midday here, so I feel like I lucked out on that one. Thank you very much for taking time out of your evening for this. And it obviously means that you could work with somebody who, like myself, is based in the UK and has that crazy time difference.
Yeah. I mean, I don't work every day, but we can work around things, definitely.
Brilliant. And you have a little ebook that I know I've got. Is that available on your website, or?
The ebook is a practitioner reference to go into my practitioner education, because I run education events for practitioners, so you go on that mailing list. But there is a little ebook on my website, which is just general 5 foods for microbial health. So it's just a little taste to get onto the mailing list as well, so that if there's anything coming up promotion wise, you get access to that.
You've got a webinar series, right? And that covers the changes throughout the life cycle, our menstrual life cycle. How many hours is that? Can people sign up and do it whenever? Is it a live event? Tell me a bit about that.
Okay, so that was my September. So I run regular education events, and I run them live, and then generally they go onto my Teachable site, and then they're available for purchase. That one's not quite available for purchase yet, but it was 3 webinars, so over 3 nights, and they were an hour each. And so it's not a big time investment, and it covered childhood, menstruation and menopause in terms of what goes on with the vaginal microbiome and how to address that. And then there's other little webinars. There's a mini one which is just assessing and addressing the vaginal microbiome, and then I have a practitioner education course which is a 6-week course as well, so that's more extensive and moves up through case taking essentially.
And well, I mean, we didn't even touch on assessments, and I'm not even going to go in that direction now, because we touched on it in that you said that we now have access to PCR as opposed to just growing them. But I'm going to get people to go over to your site and find out more, because I felt like I was a rabbit going down the proverbial hole, like just things that I didn't know popping out at me. And it was all awesome and inspiring. And I feel like I've learned a lot doing this as well. So I'm nowhere near as keyed up on the vaginal microbiome as I should be, but I will be thanks to you.
There's always more to learn, and then when you think you've learned it, they change it. So
that is the true story behind what we do, isn't it? I qualified like almost 20 years ago, and I will never finish studying.
No, never.
Every year I have to keep up with what's going on, because we really are moving ahead at a rate of knots, aren't we? So again, I'm going to say thank you. I'm going to let you head off, go to bed, because it is quite dark. Thank you very much. This was a real treat for me. I'm going to be in communication with you in the back end just to gush some more about how happy I am I got to do this. And yeah, I'll send you the link to this as well. So
beautiful. My pleasure. Thank you for having me.
Oh, it's all my pleasure. I hope everybody learned something from this. All right. Good night.
Good night.